As a practicing doctor and someone who deeply cares about public health, I've been quite vocal about my criticism towards RFK Jr. We certainly need to be skeptical of our institutions, but healthy scientific skepticism means following data, not cherry-picking it or making it up.
What does a prominent internet doctor influencer think about RFK Jr.'s claims, specifically about vaccines? Hi, I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional misinformation online. But before we get to this video, I'd like to try something new. For years I've been reacting to videos about other creators on YouTube, and now I want to hear from you. I see so many great questions and comments in the comments down below that I'd like to start addressing them in an upcoming video. So if you have a question or a comment, look at the link in the description, put your question or comment there, and I'll comment on as many as I can in an upcoming video. Back to the video. Dr. Mike is a huge doctor online, a young doctor who's been on shows and TV and all over the place. I wonder how you can be a doctor in a clinic and do all those things, but he does. And so let's see what he thinks about RFK Jr.'s comments about the way the health of our country should move. Be sure to wait till the end where you hear my final thoughts.
I want to show you who RFK Jr. really is, what he stands for, and why despite some of his ideas sounding good, he's incredibly dangerous to public health.
So why should we care about Dr. Mike and what he thinks? Well, he's had a big influence online. And a lot of doctors don't do online education, most don't, and he has an influence among a younger generation who is getting information from the internet. And it's interesting to see the family practitioner becoming the public health doctor. So you always want to consider the source. And yes, as an academic doctor, I can kind of call out different kinds of doctors. There are family medicine, internal medicine, there are surgeons, and you'll see surgeons become public health doctors, like C. Everett Koop was a pediatric surgeon, then Surgeon General. So it's okay, it's just you always want to consider the background of the person you're listening to, and he cares about public health, like I think we all do to a certain degree. And now getting into the background of RFK Jr. is a little bit of a twist. It's not saying exactly what RFK Jr. is saying, but he's changed what he said, and this is important for Dr. Mike as a background check, if you will.
However, in 2005, he began his public crusade against mercury and vaccines, and eventually joining the team at World Mercury Project in 2015, which abruptly changed its name to Children's Health Defense in 2018, where he served as chairman and sold shirts with this slogan. In 2023, he jumped into the presidential race as a Democrat, but when that didn't work out, he swapped to independent. And when that didn't work out, he dropped out and backed Republican Donald Trump in hopes of securing a cabinet position. I highlight this only to show that this issue isn't left, right, or center. It's simply about telling the truth and getting accurate health information to you. During that process, he stated over and over that he is not anti-vaccine. And if we listen to some of his previous statements from 2014, it might seem like he was telling the truth.
I am very pro-vaccine. I have 6 children. I had all 6 of my children vaccinated. I believe that vaccines are critical to public health, that vaccines have saved hundreds of millions of lives.
Now it's 2025, and we have a decade's worth of proof that RFK Jr. is, in fact, anti-vaccine.
There's no vaccine that is, safe and effective.
Well, so just need to stop there a minute. Politicians are notorious for changing their minds and changing their opinions, or even changing what they say based on political expediency. That doesn't surprise me in this case. And one important background check, if you will, on RFK Jr. is that coming from the legal field and being a lawyer who actually sued for those who were harmed by companies might be seen as a positive thing. right? In general, you're going out for the small guy. You're looking out, big companies, and then a lawyer would base their support of the person who was harmed and get paid for that sort of work, right? So it seems to me that the public health view is one of, yes, you have benefit and you do have harm. And with any kind of intervention, that calculation of the risk versus harm or benefit versus risk, so you save people with vaccines, and yes, some people will be harmed. But now if you take a lawyer who has always been sticking up for the person who has been harmed without balancing the view of all those people who've been helped, you're going to get a skewed view, and maybe even would say these people would have been helped if there were no vaccinations. But then you're going to be left with the people who were helped because of the vaccinations. So I think what's happening here is the little guy, a lawyer who was sticking up for the little guy, now is suddenly in charge, has been put in charge of a organization that actually pushes out vaccines and other kinds of programs that help a lot of people and do a little bit of harm. And if you don't have that helping a lot of people because of the few that are harmed, and that someone gets in and says, no, we can't do the big company-wide program or the big country-wide program because of those few people that have been harmed, you're actually going to miss out, and then more people will be harmed because you don't have the vaccination program that saves people's lives, like he even said. So I don't fully understand, other than the politicalization of the COVID vaccines and lockdowns and all that got discombobulated and kind of misrepresented. Vaccines do work, and yes, there are some harms, and people it's tragic. But that's true for pretty much every sort of program. Cars are helping lots of different people, but they also have a problem with accidents and things that are made wrong with recalls, that sort of thing. So it does seem kind of odd that the lawyer who's in charge of the little guy now is in charge of the company. Let's say you used to be filing lawsuits for those who were hurt in accidents because of a malfunction of the car, and now you're put in charge of the car manufacturer. You don't stop production on all the cars, because, or would you? So this is the balance that might be perturbed when the big picture is not looked at. I want to personally invite you to take a closer look at what the carnivore diet can do for you. If you've already tried low carb or keto, but still struggle with fatigue, inflammation, digestive issues, or autoimmune symptoms, this could be the reset your body needs. Inside, you'll learn why plant foods might be triggering your symptoms, how carnivore works as the ultimate elimination diet, and what makes this approach so powerful for healing and restoring your health. Sign up to get my carnivore free guide below.
Even in a more dark analogy, he compares modern doctors to Nazis for vaccinating children.
To me, this is like Nazi death. I mean, what happened to these kids? I can't tell you why somebody would do something like that. I can't tell you why ordinary cause. I can't tell you what was going on in their minds, what justifications they used.
So, you can see that if you're with people who've all been hurt in an accident because of a car malfunction, you're going to be mad at the car company because of that, and you'll be able to say things like that and not be fact-checked, and in fact it might be seen as a sign that you're one of them, because you are empathetic to the loss of a child or the autism or whatever the topic is.
Despite all that being widely available, he was confirmed in February 2025 as the U.S. Secretary of Health and Human Services, putting him in charge of some of the most important health agencies like the CDC, FDA, and NIH. And despite all his advocacy against vaccines, that vaccinated children are no longer bright, that doctors are basically Nazis, that he would happily go back and not vaccinate his own kids, He is now back to saying,
The best way to prevent the spread of measles is through vaccination. We urge people to get their MMR vaccines.
it seems RFK swaps his position on vaccines whenever he sees fit. Ironic, because many criticize the CDC for changing their medical guidance.
Well, and we're faced with a measles recurrence that hasn't happened in a long time, and that would change someone's mind about vaccination, you would think.
There is no causal link between autism and vaccines. And there's been many studies that have looked at millions of children, comparing children who have been vaccinated versus those who haven't been vaccinated, and have seen that there is no causal link. When I was doing my debate with vaccine skeptics, one of the participants said that's because the people looking at it are part of the corrupt American capitalistic system. But then the research that was done on over 500,000 children in Denmark, which has nothing to do with the US capitalistic system, also found the same exact result. This is because there is no causal link.
And yet, I've met people who saw the association of their child being vaccinated and the onset of symptoms around that. Of course, that doesn't mean it's causal, but it does raise your eyebrows.
Entrusting all of that to someone who makes statements like this
We should not be giving black people the same vaccine schedule that's given to whites.
is scary to me. Our health agencies cannot be led by someone who repeatedly denies the very science they're charged to uphold. Secretary Kennedy's long record of spreading vaccine falsehoods and undermining proven public health measures makes him a clear threat to millions of Americans who rely on accurate guidance. Certainly, he should have never been confirmed to head the office of HHS. But choosing to leave him in charge is like handing the keys to a driver who continues to insist that stop signs and red lights are optional.
Well, Dr. Mike has made some good points. I think a better metaphor, and I'm torn with this as a practicing physician like Mike, where you're advocating for the individual who's in front of you, despite guidelines and recommendations that are more population-based, like everyone should be on a certain drug, when for this certain individual, it doesn't make sense for this individual to be on that given drug, even though guidelines say so. So there's always a tension between the personal care of the patient in front of me and the public health guidelines, and the best way to go about this is to balance these. Realize that sometimes you're going to be saving millions and harming a few. I think a better metaphor is that we have a lawyer who is sticking up for people harmed by car malfunctions as a career. And so he advocates for the individual and sees that these cars are causing problems and that the company should be paying for it. That's the lawyer position. And now he's put in charge of the car company. That I hope there are people in other places within the organization who realize that if the car company isn't making cars, there will be no company. There will be no cars for good, no cars for bad, no accidents, of course, but then we lose all of the good things. So I share Dr. Mike's concerns and a whole different domain of what should be done with the diet. I'm afraid I agree with a lot of RFK Jr.'s ideas, and so don't throw out the baby with the bathwater, or don't confuse. In my mind, I'm not anti-vax. I know there's good and there's harm from it, but the diet itself, focusing on the dyes and the seed oils, this is a distraction. It's like Dr. Mike is saying, it's the ultra-processed food and the sugar and the starches. If we want to really tackle diabetes and obesity with diet, that should be the focus. If you like, please like, subscribe, ring the notification bell. I know this one was a tough one, but I think there's a tension between the advocacy for the individual that a lawyer or a doctor like me in the office has, and then the advocacy for populations, and a lot of good can be done with that public health intervention. And yes, sometimes people do get harmed. And I think that's what we're dealing with here. Please like, subscribe, ring the notification bell if you think this is helpful, and look for new content on Wednesdays and Fridays. Let me know your comments in the link down below, and I'll try to address them in an upcoming video. If you enjoyed this video, consider joining our YouTube membership for early access and exclusive live Q&As with me. Just click the join button below or support us with a PayPal in the description.